Hi, my name is Elena Sereno and my topic is Insulin-Mediated lipohypertrophy. Definition: abnormal accumulation of fat, especially within the abdominal cavity, the upper back, and subcutaneous tissue.
Lipohypertrophy is a problem that can occur at your injection sites. There is an association that when people use the same site over and over and over again, they develop a buildup of fatty tissue under the skin at that site. This is the BB Lipo Box. It's a tool that we use to teach people how to look for lipohypertrophy at their injection sites. So if you look here, this is one that we can see and it's raised above the skin. But if you come over here and you feel this area, there are lumps under the skin that are very hard and they feel a little bit like marbles. Lipohypertrophy, you can't always see it, but you can often feel it. So if you palpate the area or run your fingers over the area of your injection site, if you feel a bump in that area, that might be lipohypertrophy. And the problem, if you inject into lipohypertrophy, insulin isn't being used the way that it should be. We then end up with ups and downs in our blood sugars and we don't always know why. Like Diabetes Innovations on Facebook to learn more about insulin delivery, healthy living, and to join a supportive, welcoming community.
Nursing application. 1. Review the correct 5 correct medication, correct pattern, correct dose, correct route, and correct time. 2. Insulin is usually given before meals. 3. Select the appropriate injection site and knowing that absorption is faster in the abdomen. 4. Rotate injection sites to prevent thickening and thickening of the skin.
Many of my patients are hesitant to begin injecting insulin, but once they actually try it, it becomes like any other routine. Here's how I teach them. You'll need your bottle of insulin, syringe, and a sharps container. Always wash your hands with soap and water before you begin. Typically, there are 3 syringe sizes. 1 cc holds 100 units of insulin, a half cc holds 50 units, and a third cc holds 30 units. Talk to your care team about how much insulin you need and which syringe size you should use. Insulin needles have gotten much smaller over the years, so they are much less painful than you might expect. When you first get your insulin, keep it refrigerated. After the first time you use it, you can keep it in room temperature for 28 to 42 days. It will be more comfortable to inject. If you have cloudy insulin, it needs to be mixed. Gently roll the bottle in your hands, then rotate it from top to bottom without shaking. When you're ready to inject, pull the plunger back to the number of units needed, drawing air into the syringe. Insert the needle into the bottle of the insulin through the rubber cap. Inject the air from the syringe into the bottle. Turn the bottle upside down with the needle in it. Make sure the tip of the needle is fully submerged in the insulin as you pull the plunger back to the correct number of insulin units. This helps prevent air bubbles. Air bubbles aren't harmful, but can take up room and prevent you from getting the right dose. If you have bubbles, simply inject the contents back into the bottle and repeat the procedure. Next, inject at a 90-degree angle. Hold for 5 seconds, then pull the needle out. Drop the syringe into the sharps container, which you can buy at any local pharmacy. Ask your diabetes care manager where to safely dispose of your sharps container when it's full. Make sure not to reuse insulin needles as it's not safe and can cause more pain with injection. It's important to switch injection sites to prevent bruising and pain. Fingers width in between injection sites and keep the same distance from your belly button. Your care team prescribes insulin because it's safe and effective. We're confident you will be able to use it successfully. If you have any questions about how to inject insulin or how much to take, ask your care manager. Adjusting to a new habit can be challenging at first, but the benefits to your health are worth it.
Pros and cons. In the pros, it is a vital to control high glucose levels, and cons, hypoglycemia, worsening of diabetic retinopathy, weight gain, insulin edema.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
Application in Ecuador. In Ecuador, if this medication is applied and it is taught with caution, since the improper administration of this medicine could cause serious skin damage. And conclusion, local complications secondary to insulin application decline dramatically since the introduction of human insulin of recombinant origin. Lipohypertrophy is more frequent than lipoatrophy.
We're here today in the office. Well, not this office. The frozen countryside of YMCA Wanakita to learn a little bit more about lipohypertrophy and what people know about it. You might ask yourself, but hey, why are you in the woods? And why are you holding that sweet suitcase? Well, friends, this isn't just a sweet suitcase. This is a treasure trove of demonstration information. I'm here at Connected in Motion's 6th annual Winter Slipstream to ask the experts what they know about lipohypertrophy and how to prevent it.
What is lipohypertrophy?
I ask you the same question.
How do you prevent it?
I really don't know. I don't know how to prevent what is it?
No clue. You don't know how to prevent it? I can't even pronounce it.
Hold on a second. I thought these people were supposed to be experts. At least one of them must know what it is, right? I want to know what the lipohypertrophy is. Who knows what it is?
I think it's a dump of fatty tissue you get from multiple injections.
I think there's one person who knows, but there aren't as many experts as I thought. So why don't we hear from a real expert?
Lipohypertrophy is relevant for someone injecting insulin, whether you're type 1 diabetic or type 2. Are educators telling you guys about this? Sometimes, no. Rotate sites, and that's kind of the end of it.
So Trish, can you tell us exactly what lipohypertrophy actually is?
So it's a condition that you acquire from injecting into the same tissue when you're injecting insulin. So whether it be your cannula with your pump or your needle tip with your pen, if you're injecting into similar tissue, that tissue actually, you start to hyperproduce fat tissue there under the skin. Insulin can pool there for days and then decide to get absorbed, and that's when we a lot of the time run into these unexplained low blood sugars, or not be used at all, and that's when we run into some unexplained high blood sugars. So it's those really erratic blood sugars that we start saying, let's look at sites.
Well, now that we know what it is, what's one of the ways
To minimize lipohypertrophy, be adventurous with your sites.
if I was one of these people, how would I know if I had a lipohypertrophy and how would I find it? Hypertrophy? And I think you guys should do the same.
Thank you.